Piper Hale, and I'm a communications manager here at the Public Health Informatics Institute. If you listen to our podcast, Inform Me Informatics, you're already familiar with Immunization Information Systems, or IIS. But in case you're not a listener, let me give you a quick overview. So when you go to the doctor or the pharmacist to get an immunization, the record of that shot goes into your EHR, and from there it's sent to a central data repository, which is usually administered at a state level. This is an immunization information system. From there, the IIS can share data with partners who are permitted to have access to those data. For example, schools and daycares that need to make sure their students are up to date on their vaccinations, clinics and hospitals that need an accurate record of their patients' immunization history, and even other IIS in other jurisdictions. Say you move states and you need your records again. It's crucial that these data are complete and accurate because the alternative leaves people open to being unimmunized or getting a redundant shot. So as you can imagine, the job of being an IIS manager is very difficult and complicated. You have to build and maintain a complex information system that talks well with other systems while also maintaining the quality of the data it houses. And it has to take into account very granular legal requirements for what an IIS has to do. The people who do this job have to be true Renaissance men and women capable of wearing many hats. Naturally, when data, information systems, and public health all intersect, that's when PHII takes an interest. So earlier this year, with funding from the CDC, PHII held a 3-day training for new IIS managers. This is the 3rd year we've done this training, and we've been tweaking and perfecting it all along. Personally, I think this was the best year yet. The faculty for this course were 2 wonderful consultants that we work with very often here, Therese Hoyle, who works with the IIS in Michigan, and Mary Beth Carrillo, who until recently was with Oregon State's IIS and now works for the American Immunization Registry Association. PHII's Director of Informatics Science, Bill Brand, facilitated many of these discussions, and so did Christopher Hall, who's with our Informatics Academy. We were also fortunate to have a presentation from Janet Pfaff of the CDC's Immunization Information System Support Branch. A panel of CDC staff gave tips to new managers from the federal perspective, and a panel of IIS experts joined us to answer attendees' questions. The participants in this workshop ranged from longtime public health professionals who had just stepped into the IIS role to those less experienced with public health, some with more of an IT background, but all were enthusiastic and engaged. They provided incredible insight to us on many of the challenges new managers face, and their energy over 3 straight days of training was genuinely amazing. This is a group of people who holds in their hands one of the foundational components of public health, and it was so heartening to see their passion and dedication to accurate, complete data and good public health. The participants provided our team with detailed feedback on the course. We were really pleased with how positive everyone's experience seemed to be, but of course we'll continue to hone the course to be the best resource possible for the IIS community. If you're interested in learning more about immunization information systems, you can check out our website at phii.org. If you're already there right now watching this video, you are probably surrounded by links pointing you to our blogs, our podcasts, and our resources about IIS. Thank you for watching.